Hi, welcome to Facebook Live. I'm Dr. Annette Mercatante from the Clair County Health Department, and we have with me...
And I'm Justin Westmiller, the Homeland Security and Emergency Management Director for St. Clair County.
Great, so thanks for joining us, where we're going to try and answer your questions to the best of our ability, and certainly, as always, we're going to start out with the our weekly update with data. And first of all is our familiar page with total number of cases, which are almost 750 to date, with 135 hospitalized, 53 deaths, and over 580 recovered. So that's the cumulative number. What's changed in the last 7 days is we now have 77 new cases in the past week, and we're up to 11 new cases per day, which, if you remember, when we started this Facebook Live, we had reached a point where we were under 1 new case a day average. So now we're up to 11, and the average number of testing is also up to 250 tests per day at a 2.8% positivity rate, which is good news. That percent positivity rate is the one that we're really holding on to, hoping that that means that as we move forward, we won't see a real precipitous climb in cases. We also have things broken down by age, and of note there, and there's some questions here, is we are seeing more cases in the younger age group. So more on that later. The next slide is the overall graph that we show of when this started in March, as we went through our first big peak. Then we came down, and now we see this steady increase. Of note is the blue bars often could be related in the past, earlier in April, to nursing home cases. We're not seeing a lot of nursing home cases now. This is primarily seeming to be driven by more younger people out in the community. But you will see, unfortunately, that we continue to see this upward climb. We're not seeing an upward plateau. We thought we were going to see that earlier, and what we're seeing instead is just, again, this slow, steady increase. And then our testing data, and as you can see, we were seeing some increases in our daily testing, over 200 tests per day at this point, with a pretty stable amount of percent positives. And finally, directing you back to our dashboard, where these numbers are updated daily for you, and you can continue to see those daily updates at your convenience. So let's get to the questions and see what is on your minds today.
So we are going to start with questions that we asked people to start asking last night.
Okay.
So if you look at your sheets, you guys can.
So I'll start, and
Okay.
then what Jennifer said is we're going to start with some questions that started to come in last night. We'll start with those, and then as you bring in your questions, we'll go from there. Oops. Okay. So one of the questions that come in is increased cases due to increased testing, and the answer to that is not likely, because our percent positive is stable. What that means, as we do more tests, we're identifying more people. And that's a good thing, because we know now where some of the cases are, even though they're not necessarily landing in the hospital. This makes our job easier. But overall, more testing, the increased cases are coming because we're just detecting them more. I think I answered that question correctly. Is that all right? Okay. So what do you want to answer a question?
So one of the why does the Emergency Operations Center put out media releases on some possible exposure locations and others you do not?
Right.
Or do you put media releases out for all of them? And I guess the best answer for that is we put out media releases for possible exposure sites when we can't fully identify who the contacts or who the exposures are. And the reason we're doing that is just to let the public know, or let any potential contacts know, hey, we've got a situation where we want to let everybody know who may be involved in it, just to be cognizant of it, monitor your symptoms if you should have any, and if you do, go and get tested, not to be overly worried about it, and just know what's going on in your community.
No.
It's really that simple, right?
Yeah, so it's simple, but it's not that simple.
Right.
And the reality is, our team at the health department, when we do case investigations and we realize that a positive case is coming from a business or a public facility that problem, that situation very closely. What kind of work do they do? When were they last at work? When was their onset date? All these things go into our decision. And if we really feel that the public exposure is minimal, we will not put out a press release for those kinds of things. We will put out a press release if the public seems to have an exposure and we can't reach them in any other way. So this really is done on a case-by-case basis. We spend a lot of time talking to the businesses as well, and we come up with what we believe is a good balance between not trashing a business and at the same time protecting the public.
And that's key, and I want to make sure that everybody understands this. In all of our contact tracing, everything that we're doing inside our community, at no time and in no way, shape, or form is there any sort of shaming going on. Is there any sort of negative connotation going on at any point? When this tracing is happening, when you're getting these phone calls, it is simply a nurse here at the health department or another employee of the health department calling you just to get simple information so that we can look to stop the transmission of this disease where it started. That's all. It's simply that. Okay?
And I would say the vast majority of our businesses have done everything right.
Very much
so. You're going to do everything right, and we're going to still see cases. So that's a good point. This doesn't mean anybody did the wrong thing.
Correct.
Okay. In fact, doing the right thing is resulting in a lot of what we're finding is that these cases are not resulting in multiple cases in one location. Especially our restaurants, we're not seeing lots and lots of employees or people that customers getting infected from these places. In fact, the real pockets seem to be coming from private parties and things a little bit more of that nature. So yeah, it's not because anyone's doing anything wrong. Okay.
Right.
Let's do one more each on the paper and then we'll go.
Sure.
Okay. So the next question is, what are the most common symptoms being experienced more recently? And I pulled up the Region 2 North data, and I don't know if we have some data locally, but Region 2 North is collected from Oakland, Macomb, and St. Clair counties, and this is put out, I think, bi-weekly. And according to that, the most frequent symptom is cough and fever. At about 40%, by the way. So that's cough and fever are about 40% of the time. And then fatigue and weakness is almost 40%, it's 38%. Beyond that, it's muscle aches, headaches, chills, and shortness of breath. So those are the symptoms that we're really seeing the most of. Loss of taste or smell, despite what the media is saying, we're only seeing it reported about 8.5% of the time. So despite what you might be hearing, it's not the most common presenting symptom of COVID, at least not what we're seeing. Maybe people aren't reporting it. So just to keep that in mind. And the GI stuff, the nausea, vomiting, and diarrhea are about anywhere from 14 to 18% of the time. So it really is across the spectrum as far as symptoms that we're seeing. So we're going to know more about that as time goes by. All right.
So one of the most important questions that I've received in the last 24 hours, and I've gotten calls and many Facebook requests on this, is can we get more details on the change from 160/2020? And it came out last night around 9:15 p.m. So that executive order 160 limits indoor gatherings for regions 6 and 8 to 10 people or less.
Which is up north.
Which is up north.
Not here. We've always
been at 10 people or less. And it also limits outdoor gatherings to 100 people, which we've already been at. It also orders all the bars in the regions up north to, or closes all the bars in the regions up north as well.
If more than 70% of their revenue is due to alcohol.
It basically does everything up north that we've already been experiencing here in the lower parts of the state. So it just made it equitable across the state. There really have been no changes for us in St. Clair County. The other thing it did was it opened the casinos in Detroit in August, later on in August. I think it's August 15th.
At 15% capacity.
At 15% capacity. So
plan ahead if you want to gamble.
Yeah, so there's been no changes for St. Clair County at all. just continue on with your business
Now,
for
what
now.
this does mean, reading between the lines, is our northern communities are starting to see more and more trouble as well.
That's right.
So running up north to your cottage is not necessarily the safest place as it used to be, right? So we got to think about that as you're traveling within Michigan. We have hotspots in Michigan throughout the state.
Yeah, and you can see that as you look at the MyStart map, and there's other things out there. You know, if you look at the Harvard maps and the Johns Hopkins maps, you can see that as well.
So Jen, go ahead.
Yeah, we did have a question right now.
Okay.
Sure.
Today that said, will restaurants stay open inside if there are more than 10 people? So people are still confused.
So this, again, does not have anything to do with the restaurants. Restaurants are still allowed to stay open at 50% capacity. They do not have anything to do with the 10 people indoors. They're two separate things. So restaurants are still able to operate at 50% capacity of their normal fire marshal capacity. So that's how that's figured.
And remember, you're supposed to be wearing your masks as you come into the restaurant, as you leave, when you go to the restroom. But once you're seated at your table, you can take your mask off to eat and drink.
That's correct.
Those are kind of the ways we're trying to control that. And that would include, if you're out on a patio, you should be wearing your mask as you go in and as you come out.
Right.
Okay.
Okay. Somebody asked, where can people get tested and how long does it take to get the results?
Okay, so testing continues to be, as I mentioned in my op-ed, kind of the thorn in our side. Even though we're doing a little better job, it's still really available at the sites that it was a month ago. So at our hospital systems with the doctor's order, several of our medical express places, and if you don't have a doctor's order, it's here at the health department. I will note that the health department is trying to expand those sites to other communities, especially in the month of August, to help accommodate with our potential return to school. So more news on that very soon as we settle those locations. But again, those are so a doctor's order at any of your hospitals or here at the health department, give us a call at 987-5300 and we'll schedule an appointment. The timing is getting a little better again. I heard that our Tuesday screenings, we actually are getting some results back, but it's anywhere from 48 to 72 hours for a result to, unfortunately, upwards maybe of 5 or 6 days. And it varies based on the lab, the amount of tests that they're getting, and we continue to look for solutions for that. It's frustrating. The note there is if you felt concerned enough to get a test, please continue to self-quarantine yourself until those results are available. We are seeing people who get tested, and while they're waiting for the test, they're bopping around, they're going to parties and stuff, and back positive, and they're, oops, we got to go back. Obviously, if you're ill, you shouldn't be going out at all. But if you're feeling well and getting tested because you feel like you might have had an exposure, please pull back a little bit. And you know, Jen, I do need to answer this question earlier. It came back. It's really an important one. And it's if you're exposed to someone who has tested positive, when should you get tested? And that's a really kind of a tricky question, but it's a really important one. So if you're exposed to somebody you know is positive, you should be receiving a call from the health department if your exposure is considered high risk, and that's within 6 feet, greater than 15 minutes. So just passing by somebody in a parking lot who's had a positive case is not going to put you in a high risk exposure. But if you really do feel you've had high risk exposure and you want to self-quarantine yourself, getting a negative test during that time does not mean that your quarantine period is exempt. A quarantine period means the time it takes for that virus to replicate in your body, and that is 2 to 14 days. So you don't want to go before 2 days, but let's say you go on day 5 and your results are negative. That doesn't mean that you're not going to become positive on day 13 or day 14. That incubation period is really solid. It's 2 to 14 days. So until that 14 day is over, you cannot in good conscience say that you don't have the infection. And what I want people to hear is that a negative test, if you're feeling well, a negative test does not get you off the hook for that 14-day quarantine period, if in fact you've had a high-risk exposure. Now, if you're just worried about it because you were walking around a mall and you weren't sure, that's a different story. Negative test might make you feel a little bit better, but it's not a guarantee the next day you're not going to have a positive test. That's if you're feeling fine. If you're sick, you're sick. If you're sick, you get a test and you stay home until those test results are back. And if it's not COVID and you've got an ear infection, that's a different story. I know it's confusing, but we don't want people getting tested and walking around for days while their tests are pending. If you really feel you've been exposed, stay home. 14 days is the quarantine period, with or without a negative test. I hope that's clear.
And I want to add a little bit to that stay home. We're getting close to bringing our kids. And one of the things we really need to make sure we get through to everybody in our community is, and this is something that is going to be a struggle for people, if your kids are, if they have a cough, if they have a fever, if they are sniffling, if anything is not normal, please keep your kids home. This is going to be very important this year more than any. You must keep your children home.
Here's one though, if you really want your kids to go to school at all in person this fall, is we need to pull back now. Okay? These cases where people are going to parties and they're interacting with each other are resulting in multiple positive cases. It's just a matter of time between that gets out of control. Remember, if we go back to a phase 3 through the governor's My Safe Start data dashboard, there is no in-person school, okay? And we have no control. We have a little bit of control over that in the sense that right now we could be pulling back and make sure that we stay in a phase 4. So that's our rally cry. Let's get our kids back to school in the fall.
Yeah.
Not going to be easy, but we're not going to do it at all if we're spiraling out of control in the next few weeks. Okay.
Yeah.
We'll start back here again. Somebody asked about Canada. Are Canadians able to enter the U.S. at this time?
Currently, so the question is, are Canadians able to enter the U.S.? Unless you are a dual citizen or you are an essential worker, you are not able to enter. The Canadians are not able to enter the United States, and the United States is not able to enter Canada. The borders are closed for regular movement back and forth.
Mm-hmm.
Okay, you've already talked about the most common symptoms, but this person wants to know, what is the percent, if you know it, of those positive tests with people that actually had symptoms?
Oh, I do have that information. Again, I have that regionally. I don't know, you can shout out, Brandon, if we have it. But for the region, 7.6% of all the cases are asymptomatic that we know of, that were reported. Obviously, that means the rest of them had some kind of a symptom. Brandon, do you have anything on our data locally, or we can get back to that maybe next time? We'll report on that next week. We're not really necessarily breaking that.
Okay.
That's a really good question.
It is a good question.
Next question. Somebody wants to know what about the Algonac cases?
Yeah.
No, I don't have, I'll be honest with you, I've been on vacation trying for the last few days. I don't have details of any of our cases. Not to mention the fact that public discussion about individual cases is kind of off the table.
Yeah.
If it relates to you and someone you know, you'll be talking to us. And if it's not, just the general information. And I want to go back to the idea that there is not one part of our county that has no risk. Okay? The risk is really based on what you're doing. It's not that we have hot spots in the community that you're greater at risk just going outside or going to a store. Because in our community, people go to stores all over the place, right? We drive up to the north end to get one thing and we drive south end. So it's really not about where you live, it's about what you do. And let's just keep that in mind. Okay.
But I will say that every time we have situations such as that situation, it is really fantastic, and we appreciate all of the teamwork between the school districts and the health department and the emergency operations center. That will always be that always works really well together, and it did in this situation.
Okay, are we set up to test for antibodies?
Who, us as a health department? No. Antibody testing continues to be a very inaccurate and questionable test, especially with low rates of transmission, under 10% where we're at. some of the results are literally 50-50 as far as reliability. Now, you can get antibody tests at the hospitals. The hospital systems that they're using are probably the best antibody tests that we have. So if your doctor orders one, have them go through either an official lab. The fingertip ones are very inaccurate, and I would not advise people to get them. They're very confusing.
And some of them are even counterfeit.
And that may be, yeah. So it's still the Wild West out there when it comes to testing. I will say that the PCR testing that we do here at the health department, as well as most of our diagnostic testing, is the PCR testing. That's the genetic material that we obtain through your nose. That accuracy nears almost 100%. So if it's positive, it's positive. Now, it can miss cases if you don't have that DNA actively replicating. And a positive case may also mean that it's old DNA from an infection you haven't completely shed. Nuances to that. But if you want a diagnostic test to identify whether you have the infection or not, you need to get the nasal swab.
So before we move off of antibody testing,
excuse me,
this person said that they feel that they already had COVID in February.
Right.
Feel better. Should they get tested for antibodies?
Well, you know, it's an interesting thing because I can't tell you how accurate those tests are. So if your test is positive, I can't tell you whether it means you had coronavirus, meaning the SARS-CoV-2, or another coronavirus that circulates commonly in our community. So these tests are not necessarily sensitive that way. It depends on the test. Likewise, if you have a positive test, or excuse me, a negative test, I can't tell you whether or not that means you had an infection and you just didn't develop antibodies, because we know there is a certain percentage of people who don't develop antibodies or lose the antibodies relatively shortly. So to answer your question is, I just don't know. If you want it for your own information, just be very careful how you interpret that. You cannot interpret those tests as being safe or immune from future infections. Next question.
Okay. Next question. Are the death rates dropping at our local hospital? Is this because the medical treatments and procedures have changed?
Okay.
Yes, but we don't know if it's because
Okay.
of the medical.
So death rates are tricky, right? Because as we know, getting accurate death reports and how many of them are COVID related. But in general, we are seeing low death rates currently throughout the county. Most deaths do occur in the hospitals, but of course not all of them. So the real question is, why are death rates low? Why are they low even though we're seeing increased rates? And I think there's a few answers that are pretty obvious. One is we have a younger population. We can clearly show that this infection is circulating in a younger group of people. We know that the infection is less serious statistically in younger people. That doesn't mean a younger person isn't going to have a bad outcome, but in general the risks are lower in younger, healthier people. So we're just going to see less complicated cases and less deaths as a result of that population. And that is because of what the population's been doing all summer. They've been going out and getting closer to each other. So the virus has not changed. In my opinion, the virus has not mutated to a point where it's less deadly, but it seems to be getting more infectious potentially from the mutations, and that means it's spreading more rapidly in people who are getting closer together. So the younger age group, and yes, we're getting a little better on how to treat it. There is no question. So the hospitals are learning really quickly different techniques short of automatically intubating, so the treatments are better, but I don't think the virus has intrinsically become less deadly or less harmful. I think that's still something we have to wait and see. My concern is that as the transmission continues to go, it's going to get back into the older populations again. Right. And then we're going to see those rates increase, and we're going to see it in 2 to 4 week intervals. Because I talked about that 14-day incubation period. So if the first group of people are young and relatively healthy, we're going to see lower hospitalization rates, lower deaths. But after about 2 or 3 transmission cycles, meaning 2, 4, 6 weeks, as it gets into the older population, more complex, we're going to see more of those hospitalizations. And I think that's what we're seeing throughout the country, quite honestly. Initially, low rates of hospitalizations, and then as it spreads, you get into the hospitalization rates.
This person, speaking of kids and being in younger, they want to know, are we seeing a high number of cases in younger children, kids?
Yes.
Yeah.
So we had that number.
Yep.
So the question is, are we seeing higher rates in kids?
Or how high are
So I asked our data guide to kind of break this down. For instance, in March and April, with our first wave, we saw about 2.7% in the under 18-year-old age group. Now we're seeing close to 14% in that age group. Likewise, when we see 19 to 29-year-olds, back in March it was 13.7%, and now we're close to 20%. So when we look at the case 30, 16%, 16.4% of the cases were under 30 in March. In April, and for June and July, the percentage of cases has doubled in that age group to 33%. So yes, we're definitely seeing more cases in younger individuals.
Okay, next question. Should we report if we noticed it, if we noticed an establishment is not enforcing a face mask?
So this is a tricky subject, right? So if you see habitual issues, that would be something that I recommend yes, it's okay to report it. Every time you see somebody not wearing a mask, you pick up the phone and call, because that's probably not going to get you much in the way of action. If you see in an establishment nobody at all wearing masks, then that's probably something that might get some action for you. If you see one person in an entire establishment that doesn't have a mask, then that might just be an individual issue. Could be a medical issue or something like that.
Well, in those situations, I'd talk to somebody in charge at the building, the facility, and say, hey, But if, as you said, if it's something that you're noticing over and over again, systemic, nobody, then I would ask you to absolutely call us at 987-5300.
Yep.
There is also a MyOSHA phone number, which I don't have with me. I apologize. Is that posted on our website?
No, but we'll put it on social media.
Yeah, we always put it out. Every week we put it out. We scroll it.
So because the department will also investigate some of these people with their license. So, you know, the point is that we want people to voluntarily be compliant.
That's right.
Sometimes a little push makes a difference. There's no way we're going to know. I'll be honest with you people, I'm not going out a lot, okay? I'm walking the walk. I'm not going out a lot. So I'm not going to probably be able to tell you what's happening at Walmart or one of our grocery stores, but you can and you should. And I think, you know, we can filter through the complaints, but if we get 10 complaints on the same facility, we're going to know that should take a higher precedence maybe than somebody that's just kind of
and I have the number.
Complaining.
The number is 888-535-6136, and I'll say it again, 888-535-6136, and that is the COVID-19 hotline for the state of Michigan, and that goes right to MyOSHA.
Okay, we're about out of time, but I want to make sure you address these questions.
Okay.
Sure.
Because this person is circling back to the kids. There's a couple questions about kids.
All right.
They want to know, number one, what is the, as far as cases in children ages between 2 and 10 years old?
I don't have that information. Question is, what are the number of cases in kids between 2 and 10 years old? Maybe Brandon can look that up for us. Go ahead. What's the next question?
The next one is, so why open schools if numbers for kids are increasing?
Why open schools? Well, because the lack of in-person education has a lot of harm as well. We have to weigh the potential harm with the potential good. We have a number of countries that we can look at that have opened schools, that have done very well, that going back to school has not caused community-wide surges. Now there's some nuances to that because there's a lot of things those schools did. They all wore masks, they had social distancing, and the community had control over the transmission of the virus already before the schools. We want schools to open for the benefit of our kids as well as our parents, right? We know that's the right thing to do, and we're going to have to weigh that very carefully against what's happening in our community. It might be different here than it is in another part of the state, based on what our numbers are doing.
Yeah, and nobody's saying we're gonna put children in harm's way just to begin the educational year. That's not what's being said. We're saying that we and what I mean by we is Dr. Mercatante and I are working with the superintendents to build the plan to return the children to school. That's what we're working through, and a safe return. Thank you.
Yeah, a less risky return.
Yeah, and we're working through that very diligently.
Right.
We just got off another meeting, the second meeting of the week this week, with all the superintendents, and we're working in earnest to make that happen. So, Jen, do you mind if I answer this last question before we get to the closing?
But to answer the question about how many kids, we've had cases between the ages of 0 and 10, and that's 14. In what time frame? Oh, total. So obviously not
750 cases, and we've had 14
kids
that are 10 and
between
under.
0 and 10.
Yeah.
So
I just want to answer one other question before we go to our closing, and I know we're running out of time, but the question that was asked last night to me was, do you have any other active emergencies that are currently being handled by the Emergency Operations Center in the county? And the answer is yes. We are currently monitoring the ongoing flood situation throughout the county, and we have declared a state of emergency in the county for that. As you know, 2 weeks ago we had the Meteo tsunami. That is still subsiding throughout the south end of St. Clair County and along the St. Clair River, going up and through the Black River. So there is many parts of the county that are still being inundated by floodwaters, and we're obviously managing the pandemic. So we are quite busy, and we're still working with lots and lots of the citizens here in St. Clair County for different emergencies. So I just wanted to get that out there as well.
And before we do, I know we're over, but before we do the closing, a couple other people had wondered if their kids who are younger have symptoms, or if they have a immune system, cystic fibrosis, should they get tested? Should they go to school?
Okay, so the question is for young children who are becoming symptomatic, and believe me, we're going into the fall season where everybody gets sick, right, in the fall. Yes, my answer would be, if you can, the best situation would be take them to your healthcare provider, have that discussion with your healthcare provider, and make that decision with them about testing or not. I think testing is going to be very useful because the symptoms are so similar to everything else. And we don't want to keep your kid out of school for 10 days minimum, right? Maybe longer for COVID, where they might be able to go back in 3 days after some antibiotics for an ear infection. So I think that discussion with your healthcare provider is going to be very important, and I do think testing is going to be very important. There is no age limit for testing. Any age can get tested, and your doctor just needs to order that. And we're working with our docs. Hopefully, maybe more of them can do it in their offices in the coming months.
I was just about to mention that you and I both are working diligently to get more of our doctors, especially pediatricians, to do COVID-19 testing as we get into the school year. So we're working hard on that too.
Okay, closing comments, and then if you maybe in your closing comment could talk about contact tracing and our troubles we've been having.
Okay, so the closing comments, I'll start with the contact tracing. Our goal when we find a positive case is to identify who's potentially exposed, and voluntarily allow everyone to build a little bit of a bubble around it so it doesn't move beyond, because this is just like a, it just kind of keeps extending outward and outward and gets harder and harder to control. So when we call you because you have become a case, meaning you've had a positive test, it's really important that you pick up the phone and talk to us. Otherwise, the virus has more and more opportunity to continue to spread. Spreading to other kids may or may not seem like a big deal to you, but believe me, if that kid lives with grandpa or someone else who's compromised, it can be a huge deal. So it's it really is do the right thing. We are not going to share your information. When we call somebody who's a contact you, we don't say, oh, by the way, Joe Blow had a positive test and we heard you with him. We say we are aware you had a potential contact on such and such a day. We give them dates. We don't tell who. We don't say where. We talk about the possible exposure and what they should be doing about it. So it's a win-win to talk to us. And I'm just going to urge everyone to do this because this is a community effort. And my closing remark for this is the fact that we have to live with this virus. We cannot wish it away. We are all sick and tired of it. I know we're sick and tired of it, but it is not going away. And we have to learn to live with this. We have to learn to live with the risk, which means working together to keep this thing under control. And if we don't work together on this, if everyone just does their own thing, we're going to have a lot of problems. And we're going to continue to have problems. So it's really about working together, getting our sea legs, getting used to the mask, getting used to not having that business as usual. Because you know what? This is going to pass. And it's going to pass in a way that's tolerable to all of us, or it's going to pass in a way that's like big time horrible. Okay? We have to choose which way we're going to get through this together. So that's my closing comment. Let's get this done, and we'll get to the other side. We'll all go, yes, we're on the other side. Okay.
There's obviously some significant hurdles here in the next weeks and months, and we live in a really fantastic community, and I'm really thankful to live here. I'm really thankful to work with some great professionals. And I appreciate all of you that are listening and that ask these really great questions. It's not always easy to do what we're doing and what we've been doing since March, but I just ask all of you to do what you can to work with us when we need to call you and ask the questions that we need to ask you, and understand that really good people are asking you those questions, and just keep doing what you're doing. There's probably going to be additional things that you're going to be asked to do, but just know that it's for the good of the community. It's for the good of your health, and just keep doing what you're doing. It's really great, and hang in there, and we'll be with you again next week. Thank you all for what you're doing, and have a great weekend. Thanks.
Keep sending those questions in.